Hey, Chuck.
Hey, it's good to see you.
Good to see you. We're going to talk about some of our favorite topics.
Wonderful.
We're both interested in how people are doing. We come at it from different perspectives, but we're trying to get to the same thing.
Yes.
Yeah. So you and I talked a little bit before we got started, and we were interested in health and human flourishing.
Yes. I like the human flourishing.
Yeah.
Health is great too. Don't
Health is great
understand
too.
me.
Yeah. Well, one question is, how are they related? Why are we talking about both? Can you have one without the other?
So, from your health perspective, how would you define that?
Yeah. Yeah. This is something I thought a lot about being in the healthcare profession. As you know, in my career, I'd been a surgeon and I have done other things, wound care, and even doing pain management. And so health is at the top of the list of things that I think about. And what is health? We have lots of different definitions of health. And I think, to be fair, that's going to vary by person, of course. One person may want what they would consider health, what someone else would be considering like superhuman or optimization. But health, I think, typically, health is defined in our normal everyday way of thinking, and in particularly because of the structure and shape of our healthcare system, it's the absence of disease. And I think that's pretty powerful, even if people don't think about it that way or typically, but it's the absence of disease. I don't have this diagnosis. I don't have that diagnosis. I've never had to be hospitalized. Therefore, I'm healthy. And I like to think of it in a deeper way. Health is not just the absence of disease, but I like to think of it as the proper functioning of our whole being.
Yeah.
And so, we could break that down into systems, but I don't want to necessarily get technical. But the way I think about health is my body working the way it was designed to work? Are all the systems kind of working in concert so that I don't even have to think about it? That may sound simplistic, but getting there, we're seeing, is where most people actually are not.
Yeah, it may sound simplistic, but it's rather complex.
It is complex.
I think from a mental health standpoint, almost the complement of that goes back to the healthcare system, right? Everyone's focused on, do you have a diagnosis? No, I don't have a diagnosis. Do you have a diagnosis? Oh, yeah, I got a diagnosis. Yeah, they say. And so unlike the medical community, the mental health community has a stigma around mental health. And so we can start looking at it as wellness, mental wellness, and how can that help us kind of determine where we are on that. The cool thing is when we do kind of play with that, because you kind of have to play with the range of that. So people will ask me, because I'm in the mental health field, what's the difference between mental health and things like wellness or something like mentally unwell, those kind of playing with terms. And it really is a continuum, but it's almost like a quadrant type of thing where you can have good mental health and still have good mental wellness. You can have a diagnosis and still have mental wellness. You can have a diagnosis and not have mental health, and you can have a diagnosis and have good mental health. So you kind of play with those concepts.
Yeah, tease that out a little bit. Intriguing. You said you can have mental, how did you put it? Mental health without mental wellness or with mental wellness, I think you said.
Yeah, you can have mental wellness with or without a diagnosis, and you can have a diagnosis, or, I hate using the term mental illness, but that's kind of what we're talking about.
Right.
You can have a mental illness and have poor mental wellness, or have good wellness, mental wellness.
So you're comparing how the person actually is with what kind of diagnosis they may or may not carry.
Yeah.
I see.
For example, someone who suffers from anxiety, they can have wonderful mental health. They can have good well-being. They can function in their day. They can, folks who are depressed have the same type of thing. Or their condition, their mental illness may take them down for a while, and not have mental health. So really, I like to focus on those types of concepts, and I think they're helpful for people to think about. It gives them a place to start,
Right.
And allowing them. But I don't have that conversation without the physical part. How is their physical health? Because I could be the best therapist in town, but I can't compete with someone's thyroid.
Right.
And so they're going to be depressed regardless.
Well, that gets me back into what I was saying. I said I didn't want to get technical and go into all the different systems, but this is a perfect example of on a positive and a negative side. On the negative side, we silo things. We've got mental health or mental wellness, or physical diagnoses. But we're whole people. We're whole people. And so that's what I was talking about with my definition of health. It has to incorporate all of these different areas, if you will. And so the mental health, mental wellness piece that you were talking about is very much a part of my overall health. And probably we'll get into it in our discussion, but that because we are whole beings, that's how we've been created. Each part affects the other. So you said, for instance, I can try and help my patient who has a mental health diagnosis, but I can't deal with the thyroid. Yeah. Well, we get into that because we siloed things, but that thyroid piece is super important. And on the flip side, the impact of anxiety or mental health, depression, all has correlates in the rest of our body, and they go back and forth, so
Absolutely.
to speak.
Yeah.
Yeah.
And I see that with the anxieties, because that's the population I spend the most time with, and how that raises stress levels, where it raises cardiovascular disease risk, and really can steal wellness right from their hands. I mean, it just robs them.
Right.
So,
and we've been slow to recognize that connection, I think, in many ways.
I do. Just my profession. One of the questions we should ask in our assessment, but most of practitioners don't, is when was your last physical?
Right.
And, I can't provide that for them, but I can recommend that before we start to address your anxiety or your depression, a good blood test just might be helpful. It just might. And so when we roll those out, if we can rule out the medical first, then we have a better idea. But we also know with some level of predictability where their health is. And that I think that's a benefit. And sometimes my clients are kind of confused by that.
Well, I think that's because of the way we've been conditioned. Again, that silo.
Yeah.
I'm here for depression or anxiety. What's that got to do with my gut or my thyroid?
Yeah.
Yeah. Yeah. It's fascinating how the body's connected. Most of our serotonin, for instance, is produced in our gut. And we need our serotonin to be feeling good, and dopamine.
That would be a great multiple answer question. Like, where is the balance over it? They're all going to say the brain, right? Most people think it's going to be the brain. That'd be a great question.
Yeah.
So
we were talking about health. So health is not just the absence of disease, but all of these various aspects of our body that we can look at, we can take out individually and look at, but they're all working together. So my anxiety is, as one thing you were getting at is, you could say is under control. I may have the diagnosis of anxiety.
Yeah, it's being managed.
Yeah. And so I know how to go about my day and deal with anxiety. And for all of us, anxiety things are going to come up and disturb the homeostasis, to use a technical term, the equilibrium.
The steady state.
Yeah. In other words, that's real life. And I'm not diminishing, a diagnosis of anxiety. I'm not. But you can have that diagnosis, but you can learn and develop. And that's part of training and the work that you do, because we all have to deal with that, is what I was saying. So, but then also, did you get sleep the night before? Did you eat well? Did you have breakfast? What's your nutrition? And then going down even deeper, like you said, is having a good blood test. Is my thyroid functioning properly? That's kind of like the master switch that kind of runs everything. Vitamin D levels. We know that vitamin D levels are so important with so much functioning. Oh, and by the way, have I gotten outside? Did I get some sunlight?
Yeah, we've all been there.
Yeah. Seasonal affective disorder. I am so glad I live in Florida.
Oh, that's why I moved out of Pennsylvania.
Yeah.
I mean, I wrote an article about that earlier this year, actually, because someone asked me why I moved to Florida from Pennsylvania. And I didn't know the name of it. But from mid-October through mid-March, it was gloomy, cloudy, cold, rainy, muddy, and I just wasn't as vivacious as I was during the summertime.
Right.
And I took a vacation, saw my uncle in Florida. I'm like, why am I not here? It was a very easy decision.
Right.
And then I learned, decades later, it is a real thing.
Yeah. Yeah, it is a real thing. And our bodies are so tied to our environment. And the one thing feeds off the other.
Yeah. So you mentioned the word flourishing.
Human flourishing.
Yeah.
Yes. Well, that's a good segue into when we were talking about you moving down after seeing your uncle, and the piece about the sunlight, how that affects us. There was a day and an age where we wouldn't really even think that way or take that seriously. As a surgeon, I didn't used to take stress seriously, in part because I was under constant stress. I just had to push through. And I think many of my colleagues, we started hearing about stress doing this, stress doing that, type A personality.
Yeah.
But I never bought into it because I didn't see the connection. And there's a connection through, for instance, our gut microbiome, the neurochemical transmitters that are being produced, the impact of the fight or flight, which we are constantly in or can be, and that impact, how that gets down even to the cellular level, affecting how we produce energy, for instance, and then another level up, how it's affecting our blood vessels and priming them for disease, which can, for instance, lead to a heart attack. So it was never clearly understood or described the connection between stress and physical ailments. People knew about it and they said, oh, stress is going to kill you. I'm like, what does that mean? Give me a mechanism. I needed a mechanism, but it's being worked out and it's very clear. And getting back to human flourishing, the sunlight aspect, one way to think about, or the way I think about human flourishing is just like in our person, we want to have, I'll use the term integration. We want to be integrated wholes. So I'm eating well, I'm sleeping well. That's feeding into my physical condition, which is affecting my mood and outlook. And so all of that is working well, and then I'm healthy. Well, now take that into the larger context. How do I fit in with the rest of the world? Because I live in the world. And to further flesh out this concept of flourishing, I like the term shalom. Many people may not have heard of that. You may have, but an immediate interpretation of that term is peace. But it comes from the Bible, and it comes from a rich tradition of biblical wisdom of shalom, meaning a fullness of peace, a sense of completeness, again, integration of things working well together. And so in terms of human flourishing, I put it into kind of like 3 categories. So we have my physical person, me, the individual. Is that healthy? That's one aspect. Health in my physical person. But we're relational beings. We are related both physically and relationally to the world around us, which includes people. And sometimes we think, the world would be great if everyone was like me, but that's the furthest thing from the truth. But we say that. But the point is, we are incredibly dependent upon relationships, both personally and our relationship to the environment around us in which we live. And finally, we have to be related to our Maker. We have to have peace with God. And I think that's an important, it's foundational. All of these are important. You can't have human flourishing without all of those pieces being considered. Now, can we have perfect human flourishing? No. That's an ideal that is impossible in this world. Just like I don't think we can have perfect health. And we're always going to have some difficulty. Some of it's in our control, some of it's not, in our relationship with others around us or the world around us. And we can tease all of these out. But this is an ideal. But I think having all of those, peace with our Maker, peace within ourselves, and peace, shalom, with the world around us, which includes the physical environment in which we live, and not just physical, but social arrangements, et cetera, and our relationships with other people.
Yeah, I think the mental health world would have very similar categories. We may call them something a little different, but they would be consistent with that framework. The individual, we understand the relational. A lot of that is what we do for a living is the relational.
Sure, absolutely.
And relationship to our Maker, depending on who that might be, they may use words like existential, big picture, values, beliefs, or whatever. Getting to that really, really large concept of why we exist or how we make decisions on a grander level, not just the immediate decision that needs to get made. So it sounds like there's a wide variation because we're individuals how to do that. Or one of the questions I like asking my clients is, how will you know when that's achieved? Like how do we know we're getting closer? How do we know when we're progressing in the direction that is going to? We often use the word thriving,
right, in
mental health. How do we know when we've gone from surviving to thriving, and getting that really clear? For example, I use existential therapy in my practice, and I use the example because I'm an old guy. Growing up, we would ask ourselves, why am I here? That whole seeker script, right? Why am I here? What's my purpose? And what am I living for?
What's the meaning?
Yeah.
Right.
So
And where's it all going to go?
Yeah. And where am I going to end up? And so, we've had a generation of folks like that. And that was a very strong presence back then. That was a very strong influence. And as I got older and became a therapist and studied existential therapy, and I'm like, wow, we were never going to get to it. Asking those questions, we're never going to get to it because it never was specific enough. And so, my thought is, if you understand, if we need to understand or want to understand what we're living for example,
Right.
the question isn't, what am I living for? If we reformulate it, we would ask the question, to whom or what am I willing to die for? Because then we would know what we're living for. And that kind of clears the slate. That kind of clears the slate on quintessentially what's the essence of my importance of the day.
Well, it also takes it out, in a way, out of the abstract and makes it relational.
Yes, yes. And that's the kind of the goal, because what am I here for? Well, it depends what I ate for lunch, who I'm meeting for dinner. It's going to really depend. Right. So those abstract, but they were amazingly fun. I have to admit, they were amazingly fun questions to ask. But
I bet you have lots of stories.
I do. That's a different podcast.
Yes.
But as you gain that awareness, or you gain that sensibility, or just kind of focus or study that, it does kind of go back to that shalom. What is that peace that we want? Even in our imagination, we want that peace. And does that really exist? And maybe you can address this from being a surgeon and from the medical part. Can people, or do people have the believability, the ability to believe that question can be asked, that question can be answered, and I can do that. I can achieve that. And the reason I ask that is because you just mentioned that it's an ideal. So how do we manage that? How would we kind of approach that?
Well, I think you'd probably agree, but let me know. I think we all have answers to that. And I think a lot of what your work that you do is bringing that question to the surface so that the inherent answers by which we typically live are examined. And you can have good answers or bad answers.
Or a answer.
You can have it.
Just a response.
You have an answer. Now, your work is to get people to articulate that and to sit back and say, okay, what is that answer? Is it serving me? And I think a good paradigm is it true? And that leads to another question. How can I know if it's true?
Yeah.
And certainly one way of knowing if it's true is, again, feedback is it serving me well? Another aspect is, does it line up with what I see in the world around me? Does it line up with reality? And again, that gets back to that question of human flourishing and using that paradigm of shalom in my relationships with others in the world in which I live, with God and myself. So if my answer that you have now helped me uncover is giving me agita in my gut, and I'm not feeling good, and I'm spending too much time tending to some of my physical needs, well, let's see that relationship. Let's examine that answer in terms of that question and others, and how can I reframe it, or what is this doing to me? What is a better answer? But to get back to your original question, I think we all have an answer to that. I think we have to have an answer, even if it's not articulable immediately.
Yeah. A lot of people, a lot of my clients and colleagues really have a wide range. of that. And there's a lot of folks that truly believe, Chuck, that's an unanswerable question.
Really?
And that's usually my response. And they don't, or haven't maybe, really examined it. And I think the other expectation assumed in that question is that it has to be perfectly lived out. Like, oh, I have this ideal and this is the reason I'm living, and I fail at it, most days, so that can't be the answer. Well, that's still the reason that you get up in the morning.
Right.
So, it's kind of that clarification that helps that discussion. But things like thriving in mental health, that theme of thriving, some folks actually believe that's just not in the cards for me. That concept. What would that look like in the medical field?
The thriving physically?
Yeah, or getting
someone comes to the doctor, how am I going to thrive?
Yeah.
Oh, well.
Or flourishing.
Or flourish, yeah. So I would begin with questions. What is your ideal of thriving, of being healthy? What do you understand about being healthy?
Back to that word.
Yeah.
Right. Back to that, like where we started.
It's a good starting point. Like I said, it's one of my pillars for flourishing. So I would look at them and talk with them about, do you consider health being the absence of disease? Typically, and a lot of people more and more coming to me are saying, my doctor says there's nothing wrong with me, but I don't feel good. Or I don't like where I'm at. I don't think if this continues, I'm going to be healthy when I'm a grandparent and trying to play with my grandkids, get down on the floor. I can see changes. I'm not healthy. So they're starting to get it, and they're asking the questions. And so they don't have a diagnosis perhaps, but they recognize that something's not right. And so that's a great place to start. And in fact, we are awash in chronic illness. It's estimated 60 to 90% of people have some chronic illness. And this is a problem with our paradigm in medicine. In medicine, and this gets to answering your question, Peter Attia has popularized the idea of medicine 2.0. We're very sophisticated, especially in acute care. And we're very scientific basis for understanding our physiology, pathophysiology, all of that. But what we need to be thinking about is medicine 3.0. So in medicine 2.0, we're reactive. We wait for a disease. I've heard of practitioners with the patient coming to them and saying, hey, my fasting blood sugar's 115. You don't have diabetes. True, you don't have diabetes. If it gets over 126, which is the cutoff for diabetes, then we'll treat it. We've got insulin, we've got all kinds of stuff to treat it. So it's reactive. You're fine. If you get there, we'll got you fixed.
Yeah, and that's, again, that on and off switch. Sick, not sick. Right. Healthy, not healthy.
Exactly.
Again, it goes back to that pendulum swinging so wildly, and nothing's in between.
Which is where it actually is, because when you have your blood sugar of 115, you're not well. You may feel okay. You can feel okay because you're just not aware, or like the frog in the pot, you've just gotten used to it. Yeah. And you probably see this in the mental health arena all the time. Human beings are so adaptable. It's what has allowed us to survive. We are so adaptable. But getting back to the frog in the pot, the glucose of 115, you're not well. I would look at my client, my patient, and say, you're not well. You don't feel super great, and this is part of the reason why. And so Medicine 3.0, to borrow Dr. Attia, says we have to recognize that these chronic diseases, of which that is the largest burden in the U.S. population, chronic disease, has a long latency period. In other words, a long time lag before you go from a disruption to healthy functioning to an actual diagnosis, at which point then we start treating. So reactionary, treat the symptoms, versus preventative or even optimizing someone's health. So getting back to the client, I would begin to look under the hood. Okay. So move them away from symptom-based thinking to looking for how are things functioning, including stress. And you're probably familiar with ACEs.
Yeah.
That has a huge impact on people. And so,
and folks just don't want to hear it.
Right.
They don't want to hear it.
You're poking the bear. Yeah. So that's early childhood adverse
events, experiences.
Thank you. Can have a profound impact on our health, our physical health, as well as our mental health. So looking at all those things is what
that goes back to the frog in the pot, though, right?
Right.
They've lived with that for so long.
Right.
This is my normal. Nothing's changing.
Right.
That whole topic is so huge, and it's very good research too. It was done exceptionally well, from my understanding of it, and that was a wow moment for me as a practitioner. On, oh man, we got to do better.
Right.
We really have to do better. So yeah, but the thing, and it goes back to the physical and mental health on just the terms we use. And in everyday life, we will say things like, well, I have to make a choice. I have to make a decision, right? We have to make a decision. And we focus on, oh, that was a good decision. Or, yeah, you better make a good decision. You don't want to make a bad decision. So we create this criteria for decision making that doesn't have to do with either one of our professions. It's based on kind of a good or bad type, kind of not always specific enough, as opposed to, can you make a healthy decision? Right. Is this decision healthy? Just kind of overall, is this a healthy decision or hindering?
I think even a good way to think about it is, what would a healthy person decide in this instance?
Yeah. Take it out of the personal.
And again, you have to have that framework. What kind of framework are you working with?
Yeah.
Is it absence of disease, or is it having shalom in all three of these realms?
Yeah, that's why I kind of liked the existential therapy, is because it asked those types of questions that broke out of the typical mental health questions and allowed them to explore, as opposed to cognitive thinking of correcting their erroneous thought patterns. Well, I worked for cancer patients for 20 years, and when the counseling was recommended, it was always CBT. And I'm like, I think you might want to rethink that. Not a bad therapy, but most people are going to say this sucks. The diagnosis of, and that's not erroneous.
No,
and it's causing the anxiety.
Rightly so.
So can we look at focusing and adapting, and it it would be erroneous not to focus on their big picture, because that's the,
Right.
it's a life-threatening illness. So their longevity, their mortality is ripping the veneer off of that.
Right.
And so they have a right to have some strong emotions and thoughts, certainly initially. That cognitive therapy can chill for a minute, and let's talk about other things. Not that you don't use cognitive therapy, but other counseling therapies can be helpful, and for a longer term, throughout their trajectory of their treatment and survivorship, as opposed to the episodic stressor of the day. And, let's reframe that. No, this still sucks. This is still, I don't want to do chemotherapy. Well, it's going to extend your life. Well, I don't want to do chemotherapy. So that existential and that anxiety, they're at a very nice dialectical dilemma of what's happening to them. It was a very big privilege for me to work with him. But these are the kind of things that I like playing with, because it helps us understand things like thriving and flourishing.
Well, you can even take that term that you were using, existential therapy, in contrast to cognitive behavioral therapy, CBT. Yeah. And you can sort of apply that physically. And that gets back to the question that you raised. The person with the blood sugar of 115, if we take the medical version of existential therapy, we say, okay, what is going on? How is this related to everything else going on in your body? And like I said, we can look under the hood. We can do that with doing a root cause analysis, finding out some of the issues that have gone on in the person's past. And that's why I mentioned the ACEs survey, for instance. And, someone may have other things going on that were unrecognized until one looks and say, okay, this whole picture is impacting your health. And the way it came to our attention is with that blood sugar of 115. So what have you been eating? Are you getting exercise? How's your sleep? If you have poor sleep one night, that can affect your insulin and how that affects your blood sugar. So we can become there's a term called insulin resistance, where we don't respond as well to the insulin that we otherwise could. And that can come about because of a bad night of sleep. Well, hello, in America, we're not getting enough sleep, and we're not getting good quality sleep. So anyway, I'm digressing, but the point is, all of those things can impact that one little symptom. And when you take, in your terms, an existential approach, looking at the whole person who's integrated, we can begin to tease these things out, paint a bigger, broader picture, which can then feed into approaches. The nutrition can affect the mental health, and it can help bring down the blood sugar. And that, by the way, can impact our microbiome, which is going to help with producing a huge number of chemicals that are helpful for us, like serotonin, for instance, to help with our mood. So on and on it goes.
Yeah, that's awesome. Was there anything else about flourishing that you wanted to?
Well, I think with human flourishing, I think it's probably a concept that we don't even think about. Some people probably don't even really think about health, in part because we just get swept up in our lives. But when people do stop to think, they may question, do I have a right to health or to human flourishing? What does that look like? I think, sadly, a lot of people would just say, I'm just going to go along with my best life and hope for the best. Or sometimes at a deeper level, I don't deserve to have flourishing. Or I can't do anything about it. If it's not ideal, then I'm not, it's
What's the point?
Unrealistic. Yeah. What's the point? Yeah. And that was one of the reasons why I pointed out that it's not ideal. it can't be ideal in this world in which we live. However,
yeah, go ahead.
However, we want to continually spiral towards that ideal in how we care for ourselves, how we care for one another, how we relate to our God who has made us, how I'm taking care of myself. There are things that are outside of your control. Your neighbor, the crabby neighbor next door, you may not be able to change, but you can still have a measure of flourishing if you
Respond
accept that,
differently.
if you respond differently and say, to the best of my abilities,
Right.
I'm going to live at peace with my neighbor.
Yeah, I think those are really important concepts, and the idea. One of the things in mental health, getting to that point, is that sense of agency. I don't deserve. I don't think that's for me.
Right.
Is that really possible? And those are signs of maybe their sense of agency isn't high, as opposed to someone with a higher sense of agency, that they respond to things controlling what they have control of, and mastering how to do that, managing how the course of their day goes and how much they actually can influence in the course of their day. That's a huge, huge characteristic that has almost gone by the roadside. I think the word agency has gone by the roadside. That might be antiquated by now. I don't know. But
I don't know. I think it's very good, and I think it's coming back in vogue.
But that's a really important concept, I think, for medical and mental health,
Right.
because it does create and help identify that bigger vision. It helps define, populate that bigger vision, and keep that mindset flourishing or thriving, because they get to experience that. And so when folks have a little hesitancy, or I like using the word resiliency, when they have a low resilience or a low frustration for tolerance, that's kind of like the equivalent to your blood test. One of the things what's their frustration for tolerance? Because that's going to really set the tone, set the dial for where they're going to try or not try.
Right.
And so allowing those types of things to help maybe renew their spirit on how they rethink things. I don't like using the word reframe. I don't like the word reframe. That has such a fake it till you make it type of mindset for me. But when we rethink it, we can expand how people experience, or expand how they think about it, how they approach it. And sometimes that's not taught as a child, or if that was the opportunity was taken away from that child to learn those skills as a young person, they go into adulthood and some of those aren't there. And so we have gaps that kind of eclipse those possibilities that we see or have exposure to. So I was just wanted to kind of throw that out there.
Yeah, as you were talking, I was thinking one of the things that we do is give people agency, but another way to say that is hope. So just giving someone hope, or helping them see that they do have agency, is in itself extremely therapeutic. And even in my work, just giving someone the hope that they can get better, and the recognition first that they can do something for their health, and then giving them the tools to do that is huge.
Yeah, I like the word optimism as part of that hope, and I tend to be more on the optimism side of life. I'm so optimistic. If I'm going to go after Moby Dick, I'm taking the tartar sauce with me. It's just going to happen. But folks, but that's like a default. It's a funny thing that when people point that out, But it is like a filter that you develop to see things through. You do make a plan and you do have all that stuff, but the default is the future looks bright. The future can look brighter. And a lot of folks lose that sense of hope, that optimism, and that agency, maybe from a medical condition or some type of mental health. So how would you like to conclude this? Any last words on what we talked about?
Yeah, well, I think we've covered a lot, and I think it was very important.
I'm breaking a sweat over here. I mean, we covered a lot. I'm making a left in Montana. We've gone all the way across.
No, you brought the tartar sauce. We went after Moby Dick. No, but so we looked at health in its relationship to human flourishing and saw the importance of shalom in these larger arenas, but also in terms of our personal health, even existential health. We want to be integrated. So I think that's one of the first things, that we as people are integrated wholes. That's not to advocate individualism or isolationism, but that's a starting point, that our bodies work together in a whole, and that's how we can have agency in the world, even if we don't recognize it. And that's where we get into some of these health problems, the physical health affecting the mental health and vice versa. So we're wholes, we're integrated. And then we're also part of a larger picture. And we can and do deserve to have health and human flourishing. It won't be perfect. It's something that we have to keep working at. But with the right tools, the right framework to begin with, we can have a great deal of flourishing.
Awesome. Thank you so much.
Thank you.
Awesome.
Great being with you.